Today, Tylenol bottles filled with capsules, tablets, and liquid were coming in by the thousands to the basement of the Daly Center, where Department of Health workers were logging and sorting them for testing.
At this time, Roger, we have analyzed in excess of 39,000 capsules, an equal number of tablets, and in response to your next inquiry, which is going to be how much has come in here, I can best describe it to you in terms of tons.
Have you found any with cyanide?
At this point, we have not.
Meanwhile, across town at the state toxicology laboratories, a scientist there has figured out a way to check Tylenol products a bottle at a time in less than a minute. Jorg Pearl explained his methods based on a variation of a long-standing test where he wets a specially prepared piece of filter paper with dilute copper sulfate solution, places it under a cap, waits 30 seconds, and then opens the bottle. If the filter paper turns bright blue, as it did here in bottles that once held cyanide tablets linked to several of the recent deaths, well, then the bottle does contain the potassium cyanide crystals, or did at some point in the past. The method is so sensitive it works even if the bottle has been empty for several days.
Any sodium or potassium cyanide capsule within that bottle will emit sufficient hydrocyanic acid gas to detect that hydrogen cyanide with this testing procedure, and the test takes about 30 seconds.
The technique was just invented this morning, so word of it had not yet reached the city Department of Health people who are running the massive testing program ordered by the mayor.
Okay.
Yeah, but how do you know there's one pill in there?
All right, we'll consider it. It's something to be looked into.
Think you might use it?
We don't know yet.
And so the creative testing is starting to catch up with the creative tampering, but whether it'll catch up fast enough to catch the criminal remains to be seen. Roger Field, Channel 2 News.